So we're at CES 2011 here, and you are Medapps.
Yes, Medapps. I'm Bruce Bowers, VP of Business Development at Medapps in Scottsdale, Arizona.
So what do you do?
What we do is we provide products and services for the healthcare industry. What we've designed is a very effortless way of pulling the medical information that's derived from off-the-shelf medical instruments, pulls the information off the products, and automatically sends it up to our backend, which is called HealthCom. HealthCom was designed for administration use where you can have over 400 people monitored and looking at the bios for them. So what we've done is we actually have 4 modalities. If you look at this chart here, you can see we have pulse ox, we have glucometer for the diabetics, we have blood pressure for hypertension, and we have weight scale for the CHF, where CHF has one of the first symptoms that happens is increase in weight, so we monitor that near real time. It's a very fast intervention, early intervention.
What do you say,
CHF is congestive heart failure, I'm sorry.
All right,
yeah.
okay.
So let me go through those. So if you look at what we cover the diabetics with the glucometer.
Yeah.
We cover the COPD, congestive obstructive pulmonary disease, with the pulse ox. It measures blood oxygen. We'll show you that in a second. We also have the weight scale down here, which is the congestive heart failure. We'll show you that's Bluetooth. These are mostly all Bluetooth oriented.
Yeah.
And then what we do is we actually have some suppliers that don't want to put the Bluetooth modules in to keep their price low, to look at other aspects of their business. For instance, in the case of the glucometer, they want to keep their price point very low, and then what we do is, if you see this wire, I don't know if you see the contrast on your screen there, but you can see the smart cable. Then we actually have designed and manufactured this in Arizona as well, where we couple the output of the glucometer to the input of our device. This is HealthPal. HealthPal.
Do you have one of the? Can we see how it looks? The HealthPal.
Sure. You want to see it outside here?
Yeah.
Okay.
Because it turns on and all these things on the screen and stuff.
Yeah, you can see. I'm just going to turn the device on for you. Okay.
So what does it run? What kind of software inside?
It's our own home-brewed software. We actually, under our roof, we've done all the mechanical engineering, all the electrical engineering, all the electrical tests, the firmware, and the software for the back end is all under our roof. The only thing that we do outsource is manufacturing of the component of the product itself. That's done locally in Arizona.
So it transmits with Bluetooth to a PC?
It transmits Bluetooth to our GSM module. So we actually have, this is a GSM.
This is GSM
module.
inside?
Inside, yeah. You can see the antenna nubs sticking up here.
So you don't need a PC?
You don't need a PC.
All right.
So here you're pulling in the circuit. I'm sorry, you're pulling the medical result.
And you use data? Like you need a data package somehow pay
for
data?
Sure, I'll show you that later on. So now this is, if you look at the HealthPal, is really the data acquisition and transmission portion.
Okay.
Then the back end is actually our HealthCom system. Okay. The HealthCom, as you can see, has a lot of different modalities per person. And then what we do is we start to accumulate data in the back end with HealthCom. First of all, it's near real time. You can actually provide data back to the healthcare provider very quickly for early intervention again. Okay. But as it gets more and more data, you can do trend analysis over time, looking at different treatment effects, making sure you can see that very easily, making good diagnosis very quickly. And over time, we actually put thresholds. Once there's a significant sample of data, we put primary and secondary thresholds. When it hits through the secondary threshold, it gives an early warning. When it goes through primary or critical threshold, it sends an automatic alert, no buttons pushed again. All right. And the last thing is that we can send that report, the summary report, to the doctor, to a loved one, and to the individual. Now you have the health team, which is very psychologically very strong.
All right. Is it something that people wear, or is only you do periodical tests? You take your blood pressure, you take the glucose, and you take so it's some things you do once in a while. Nothing you wear all the time, right?
That's correct. That's correct. It is a home-based model at this point. We do have some other products coming out, but currently it's home-based, where these are intended to be done at the home. The nurses then therefore can take less trips to the home. It's less costly, but actually there's more information and they can concentrate on and focus on doctoring and nursing.
Yeah. So the patients do it daily, once a day, or
Whatever. It depends on what the doctor prescribes.
okay.
Yeah. For instance, some diabetics, we have a diabetic in our office.
Yeah.
They're 3 times that in a day.
3 times in a day.
3 times a day.
And so that's how many of these glucose for diabetics are actually this way electronic and connected? Is that a market that's growing, or?
Yeah, it is growing. What we like to do is be agnostic on the front end for the medical instruments. So we actually can add more and more glucometers. This is a Johnson Johnson LifeScan, but we tell all of our suppliers we're agnostic, so we'll be adding Abbott and Roche and Bayer. And we actually have drivers that can go up on the network, come down into our device, load that driver, and then couple to those devices very quickly. And that's just being completed right now.
So this is kind of new. But you're ramping up. You want to mass produce?
Yes, we're in mass production. We have over 600 units in the field. We have about 200 more on order. And we see orders in the thousands just now starting to appear, and that's making me smile right now.
So when you have thousands of customers, the price goes down.
Of course.
What will the price end up being?
It depends on what we're talking about here. Let's take diabetic, for instance.
Yeah.
Okay, for the equipment set, it's between $500 and $550 for the equipment. And then there's a one-time activation fee, which is around $35. And then if you look at the monthly fee, which gives you all the things I just mentioned on HealthCom, $20 to $40, depending upon volume.
All right. That's an example. And the weight is different price and all that?
No, it's all included. One price, we get, I mentioned diabetic, so it'd be just the glucometer, right?
Yeah.
Taking the reading that we're going to take in a second here. So let's do that now.
And the 2025 includes the GSM, is that the whole kit you're talking about for that price? Or?
That's correct, the whole kit.
So it includes the GSM connection in the monthly.
That's right. There's no additional fee there. Yeah. So diabetics are used to taking. This is just sugar water, just to make sure you know. Okay. And we're going to do a sample here. What the people do, they'll prick their finger at this time to get the blood sample. So we're simulating that. Here, this is what we do for the stick, the strip. We actually install it. You'll see a code number come up. So that's just a correlation to the code and the strips that we're using. So I'm going to say OK. It now says apply blood.
Okay.
And what we're going to do is I'm going to watch this with osmosis go up into the strip. And you see it's gone up into the strip, and now it's counting down. And we have a reading of 136. So once we pull the strip out, right now the circuitry that Medapps has developed is pulling the result out of the glucometer. You'll see it go through the smart cable and into the Health Pal.
All right.
Your blood glucose read is 136.
And it's beamed on the web?
Not yet. We wait 3 minutes to cool. It'll allow other readings to be taken, and after 3 minutes, and we'll show you that, then it goes up automatically to the servers in Arizona.
All right. So the whole pack, you said 550 is everything?
550 is the glucometer.
Glucometer.
The smart cable.
And then there's
And
a
the
price for
Health
that?
Pal. Right.
Is that more than, that's extra?
That's 550. That grouping right there. Okay.
And that's something else?
This is something else. So if you look at the Health Pal and the blood pressure monitor, which would be for hypertension, it's about $600.
Okay.
Okay. Then if you look at using the Nonin pulse oximeter, and we'll show you how that works now. I'm going to take the oxygen content of my bloodstream and my pulse rate. So it's 96% oxygen, 83, 82 beats per minute.
Okay.
Your pulse ox reading is 95%.
So that gives the user an audible feedback. My mother has one in Indiana. I monitor her in Arizona. She doesn't look at the screen. She just listens for the reading to go through. Okay. We'll wait. No one wants to get on the scale. I guess I'll do that. But if you want me to show
I'll do it.
Okay, you want to do it? Yeah, you can do it. Here, we're going to put the switch on and give me 1 second. When it says pounds, should say kilograms. We can change that over to kilograms too, by the way. It's accessing your weight now.
That's a secret.
It will be secret pretty soon.
Temperature sensor and allowed those devices.
Okay, there's your reading.
Okay.
If you want to show that. Okay, there's your reading. And you'll see that come on the screen as well. Let's go. It'll do it.
All right.
This
And
protocol.
that means with GSM.
Yeah, it'll come on here in just a second. This one, the protocol takes a little bit longer for the scale we noticed. Okay.
Are you selling in Europe?
Not yet. We have evaluation samples in Europe right now.
All right. Okay. But thanks a lot.
Okay, you bet.
Thanks.